Hi, I'm Madison Kleckler. I am a pregnancy and postpartum athleticism coach, a donor-trained birth doula, and a postnatal fitness specialist. I want to talk to you a little bit today about your story, or rather, whether you feel like your story of your pain and your symptoms is being heard by the people trying to help you. So I'm going to ask you a few questions before we kick this off. Have you ever felt dismissed by your provider? Have you ever felt like your provider was very quick to offer you an "it's normal," shrug their shoulders, prescribe you medication, or send you for a surgical consult? Have you ever felt more alone and more frustrated after you left your practitioner's office when you were trying to get help? If so, you're obviously not alone. Many of my clients, of the women that I talk to, have gone to their practitioner for pain and symptoms that may or may not be pregnancy or postpartum related and come out feeling alone, frustrated, and dismissed as just normal or sent to see a surgeon about their issues. Research tells us that patients are often interrupted within the first 20 seconds of their consultation. So within 20 seconds of them beginning to tell their story, they're being interrupted when there's so much more to figure out. I've personally had situations in my life where I have felt alone, frustrated, and like nobody was listening to my story about my pain. So I remember when I was maybe 4th or 5th grade, maybe a little earlier than that, 8 to 10 years oldish, um, was really the first time that I felt like I had to advocate for myself as far as pain and symptoms, my health care has been concerned. Rather, at that time, it was really my mom advocating for me. So when I was about that age, I began having some severe lower abdominal pains that would onset suddenly. They would last for a few hours and then go away. It was a pain so severe that it would make me double over. I wouldn't be able to move for a while. I just remember at one point laying on a bed, curled up in a ball, holding my stomach because it hurt so bad. Obviously, the first time this happened, my mom and I went to the ER, and I don't remember much about that ER trip. I do remember coming out with no answers. All of my tests came up normal, everything seemed normal, and the pain went away about 2 hours later. And then we were discharged with lots of shrugged shoulders, not very many answers, and it was very frustrating. Have you ever felt that way? So frustrated that you go in for answers and you come out with just a shoulder shrug and I don't really know what's going on. So obviously we thought that was going to be the first time that happened, and we were wrong. That sudden onset pain kept coming back for the next several months or so. And sometimes it wouldn't come back for a week or two, and then it would just suddenly be there, doubling me over, feeling just like somebody was sticking a knife in my lower abdomen. It was awful. So we'd had several doctor's trips at that point as that pain started coming back, and my mom could probably tell a better story about what they actually said, but I do remember ovarian cysts being thrown around and endometriosis with really no thorough explanation to either me or my mom, like if that was the case or what that meant for me and my pain and my future and my treatment. I remember feeling very frustrated, very lonely, and somewhat scarred by the situation because I felt like nobody was listening to me. It was like, well, it was all mental because I came in with this severe pain and then a couple of hours later it was gone. So it was just all in my head. And they may have actually said that, I'm not quite sure, but there were lots of shrugged shoulders and I felt so very alone and so very frustrated. Have you ever felt that way? Like you go to your practitioner or somebody for help for pain that you're having or for symptoms that you're having, and you come out feeling like, well, I'm just crazy. It's all in my head. That's how I felt. And after a while, the pain went away. It didn't come back. It has manifested in other ways, I believe, throughout my late teens and into my adulthood, but that particular pain just kind of went away as suddenly as it came on after several months or so, and we just never got answers to what was going on. If my story sounds familiar to you, if you have felt some of those feelings that I was feeling during that time, I want you to know that there is help, and there is hope, and there are people out there who will listen to your story, who will give you the help that you need, who won't dismiss you and your symptoms. I want you to reach out to me at madison@madisonsmamas.com if you need to find a pelvic health practitioner who will listen to you, if you need to find a doctor who will listen to you, please reach out to me. And I've got an amazing new 6-week program coming up, so if you're finding that disconnect between your symptoms and your fitness, I am here to listen to your story. I want to help you reach your goals. So reach out to me at madison@madisonsmamas.com.